Hey, it's Shelby from Turn Sounds. The burpee was invented by an exercise physiologist.
Hey, I'm Abby, a clinical nutritionist.
And I'm Shelby, a clinical exercise physiologist, and this is the Move Your Mind podcast.
We are sick and tired of people being led astray by false information about diet and exercise.
So join us as we discuss common misconceptions about food and fitness with the latest scientific research.
Let's get into it. So, I think I've had my fair share of turn thinking about what I do and talking about what I do as a clinical nutritionist. So today's episode is going to be all about Shelby and what she does as a clinical exercise physiologist.
Yes, it's quite a mouthful, isn't it?
Yeah, it really is.
It took me a good year to be able to say it consistently without going physiologist.
It's a tongue twister.
Yes, clinical exercise physiologist is what I am. It's my qualification.
Yeah.
It's a good one.
I was saying actually before we started recording this, obviously we knew what we were going to talk about, but I was like, Shelby, I don't actually even know if I know what you do. I know portions of what you do in terms of working with clients in a gym setting to help them achieve their fitness goals, but I know there's so much more that you can do because obviously you spent 5 years at university studying, so there's got to be more. Tell us.
And that I think is absolutely the case. A lot of people I come across who I tell have no idea what it is and maybe haven't even heard of it, which is really interesting because that's fine. Yeah. So at the base of it, an exercise physiologist uses exercise as medicine. It's kind of like a really one sentence way to put it. So that's helping to treat, manage and prevent chronic injury, disease and conditions.
Yeah.
So yes, I can deal with healthy populations because I want to avoid whatever it is, type 2 diabetes, osteoporosis, heart disease. But also if you have that condition, I am capable to use exercise to help you better manage that condition.
Yeah.
Or even get out of it completely or whatever the case is.
Which is really cool because I think sometimes if people are living with chronic illness or chronic disease, maybe exercise will be the first thing that they take off because it's an extra stress on the body in quotation marks. So they're like, oh, well, if I'm unwell in some way, well, then I shouldn't exercise because that's too hard for my body. But no, not necessarily at all.
The majority of the research is putting exercise as one of your number one treatment options for many, 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 many different conditions. Not just musculoskeletal related, like kidney disease, cancer. Exercise should be high up on the list of things you utilize to help you manage that
kidney disease. I can think
don't
cancer.
Ask me about that. I just know it's in the list. It's not something I'm interested in. I don't know how it works. But
damn,
I wrote it down to show you the breadth of what we can deal with. I don't know anything about kidney disease.
But you could.
Yes,
because you have the scientific knowledge to build upon what you read.
Exactly. I just have to look into the current recommendations.
But it hasn't been a passion of yours.
Or more so, I would be able to deal with it because I know the principles of prescribing exercise, but I couldn't tell you the nitty-gritty of why it works.
Okay.
Versus the other ones where I could tell you why it works.
Yes.
If that makes sense.
Yeah. What are your passions? Which chronic diseases are you like, yes, I would love to work with you?
I kind of a range, but probably in a umbrella kind of term is neurological conditions. I'm really quite interested in stroke, spinal cord injury, Parkinson's disease.
Motor neuron disease, things like that?
Yes.
Yeah.
Things like that. So chronic or degenerative because you can have you can really slow down the progression of the symptoms with appropriately prescribed exercise, which is really amazing. And you can have these massive effects on quality of life, which I think is just so useful and life-changing, and all you have to do is exercise 3 times a week. It's just amazing. So that kind of area is something I'm really, really interested in.
It's interesting to note, though, that, the 3 times a week is where you'll start because some people think exercise, surely I'll have to do it every day. You take a pill every day, so I'd have to exercise every day. No.
Exercise is much more efficient than a lot of medications.
Yeah, and recovery is a part of it too, obviously. Absolutely, so then you wouldn't be slogging it out every day. You'd be initiating some sort of change or an adaptation through exercise and giving yourself time to recover and then doing it again,
Yes.
recover.
So a massive part of exercise physiology is or should be lifestyle and behaviour change as well.
Yeah.
So that's something really big that we cover that some of the other allied health professions don't necessarily cover is like, so we can really help with smoking cessation, so stopping, quitting smoking, and things like physical inactivity during the day, like obviously, but things like, changing habits and changing behaviours for that healthier lifestyle as well.
Yeah.
So that's why we've talked about it before, kind of like that cognitive behavioural therapy type stuff. It definitely has a place in exercise physiology as well, because that's under our scope, is to help change behaviour.
Yeah. So does that mean you use CBT exclusively, or it's part of CBT exercise?
Yes. They kind of like, I can use exercise and CBT.
Give me an example. I'm interested.
Well, so like something like, so another thing I'm really, really interested in is chronic pain, and just pain as a sensation in itself. So something like that where you would use cognitive behavioural therapy is that someone has stopped moving. They sit in their recliner all day, every day, because they have this belief that if they go up and go for a walk, that it's going to cause them pain.
Yeah.
And so you can use the types of experiments in CBT to challenge that belief. And so we can appropriately grade exercise. So like you start off with a 15-second walk or something.
Yeah.
And then sit back down, and then you use the elements of CBT to show that, hey, that was okay for you. We know you can do this. And then from an exercise like specialty point of view, we know how to grade and progressively increase the exercise amount in a way that's helpful and that can increase.
Safe.
Yeah, exactly.
Cool.
Did that answer
No,
your
that
question?
makes complete sense.
Exactly.
So kind of using exercise to restructure thoughts almost to then change the behavior that's harmful.
Yeah, absolutely.
Yeah.
Yeah.
I like that. I mean, I've probably experienced that with my own back issues with my scoliosis. I definitely went through a phase that your advice helped me through, because I was fearful of doing certain types of exercises because I associated them with pain.
Yes.
And then once you said, give this a go, like it's okay, I gave it a go.
Exactly.
And then slowly incrementing, and I'm like, I can actually do this.
Yes.
My body's capable.
Yes.
So it's so beneficial.
Yes. So that's quite a big role in exercise physiology as well, is that I'm your support network. So that's quite a common thing I'll say to people when I meet them. I go, like, I am now part of that support for you, so use me, lean on me.
Yes.
And that kind of also means that my role is there as like a guide. So like I can use what I know and my expertise to like guide you somewhere, but ultimately it's your
decision.
Yes.
Yeah, so
your
you're not like say a PT that someone will come in completely blind, not know how to use anything, and you just give them a plan. You're like, this is what you're experiencing. Tell me what you're experiencing. Oh, I believe this will be helpful. What do you think?
Yes.
Yeah.
And the one of the most effective things you can do is, instead of me saying, all right, you are unfit, so therefore you need cardiovascular fitness, therefore you should walk 3 times a week. We might do an assessment that shows that your cardiovascular fitness is low, but you would have already told me that because you're out of breath and you don't feel like you have enough energy to get through the day. So then I would almost like parrot that information back to you and say, cool, you've already told me this, this, and this, and that's supported by this assessment that we just did.
Yeah.
How can we increase that for you? What do you like doing?
Yeah.
And that's where you might say, I actually really like swimming. I hate walking. And go, brilliant. So let's do that. And then we would develop plans to do that. And then included in that should be things like addressing barriers and addressing things that come up. So then I like highlight all the things that could go wrong and we troubleshoot them together before going forward.
Yeah, I love that.
Yeah.
And I feel like in my head, I'm like, you do this because you're a great exercise physiologist and you're amazing at what you do. But do you think as part of exercise physiology training, everyone's trained to frame it that way and address barriers and strategies? Or are you just a good one?
Bit of both. It was definitely part of our course. Like we would do our tutorials and we'd be given like the paragraph case study. And part of the questions we'd have to answer every week are highlights and barriers that this client might come across.
Yes.
So that was definitely highlighted. And then I guess it's a skill to then get those barriers from the client instead of just coming up with them yourself, if that makes sense. So that's more of a communication skill that I've actively worked on.
Yes.
And I follow people that I admire who do that really well and
Awesome.
who give advice out on how to do that better.
Yeah. Amazing. Is there a setting that I don't want to say that you wouldn't use your client preferences, but is there a setting that you as an exercise physiologist could be in that someone comes to you and you have to put something together for them in terms of thinking like prescription medication? Like there's no option. That's what you have to do.
Yeah, good point. So not something I have a massive amount of experience in, but I know exercise physiologists work in like the workers' compensation area. So you get injured at work and then work is paying for your rehab. And then and this is why I haven't done it because it intimidates me, then there are certain expectations on you as an ex-phys to get that worker back to work within 5 sessions.
Where they were.
Or whatever. So that then there's a little bit more on you as the clinician to prescribe efficiently enough that they get back to their work because work is paying for their time off and their rehab and whatever. So I think that might be a little bit more, you have to do this, and this because you need to be back by this
There's
time.
more pressure.
Yes. And I don't like it.
Yeah, that's fair enough.
Because there is so much onus on the client to actually do that if they don't.
And you might get the blame for someone's
then
actions.
you don't get any more referrals after that and it's bad on you and whatever.
Yeah.
So, and then that's also the type of client who might not necessarily want to go back to work. Like there are lots of psychological factors that come into play that I don't necessarily, from my understanding of that situation, I don't know if you get enough time to deal with.
Well, that's a barrier, isn't it?
Exactly.
It's interesting though. If I thought about someone doing workers' comp and having to, work with exercise or manual physical therapy back to where they were, I think OT.
Yes.
An occupational therapist.
Yes.
So why are you different?
Because it might be, so OT I would put more in the setting, like they would come and help you set up your office space or help you with how you move at work. But if it's
like daily tasks is OT, but you will go more like the additional.
Maybe this is where it's like a massive grey area because also like I did a whole workers comp like unit and we have to look at like you factor in things like how many times do they climb up and down the ladder every day and are they wearing the appropriate shoes and could they be using a forklift for more things where they're doing manual handling. So like we would look at that too. It's just I guess another like avenue of exercise physiology that I'm not interested in pursuing. So I don't exactly know.
Yeah, no, that's fair.
Yeah.
That's fair.
But yes, OT is good like that as well. Absolutely. So a few other areas in which an exercise physiologist can work. We can definitely work in hospitals, although that's less common as much as I am aware in WA, Western Australia. It's a little bit more common in the eastern states.
Yeah.
Which is fine. We work in gyms a lot. My first job was in a physiotherapy clinic, so I worked alongside physiotherapists, which was good. We can work in like a laboratory setting. So if you've ever had to have an exercise stress test or an ECG or whatever for either health or to clear you for work, we can be part of that as well.
That's what I picture, like someone on a treadmill with all the cords coming off them and you with a little notepad and a pen writing down stuff.
So that was one of my prac placements. I had the job of putting the ECG leads on, so you have to like clean and shave everyone's chest and stick all the little pads on.
You're like, I studied 5 years to shave someone's chest.
It's a little bit that job, it's kind of like and then because I was only on prac, I didn't have a massive role otherwise, but otherwise you would run the tests and have a role in interpreting the data afterwards. Which I didn't as a prac student, but that kind of, it's less clinical maybe in the fact that it's more of the assessment side of things. You don't ever prescribe exercise.
Okay. Yes, I see. Yeah.
So wide range of places we can work and a massive range of conditions we can work with. Yeah.
I'm just trying to think of all these questions. Like, it's in my head. Like, I know what you do.
So, like,
but
if you have a heart attack, an exercise physiologist.
Yeah, like examples.
Yeah, is really good. So, one of the hospitals in WA have a really good gym associated with them that if you have any kind of cardiovascular, cardiorespiratory incident, heart attack, stroke, things like that, they have a gym on site. And so pretty soon after you have that, you should be completing exercise, particularly aerobic exercise, because it gets your heart back strong.
Yeah.
So that's where we would be in a hospital setting. And so heart attack, but even things like managing high blood pressure, high cholesterol, that can be done with exercise, either in conjunction with medication or sometimes as a first point of call before medication.
Mm-hmm.
I've got written down all my other ones I said, neuro, so stroke, Parkinson's disease, spinal cord injury, even things like cerebral palsy and congenital kind of defects as well. Yeah. We can go into the mental health realm, help kids and adults with autism and things like that.
Yeah, that's so cool.
Cancer, kidney disease, any kind of injury you get in your body.
Yes.
Fibromyalgia, like chronic pain states,
mm-hmm.
things like that as well.
And even things like, I'm just thinking with clients that we've worked with together, like fertility even, like getting to the ideal weight to conceive, or even things like blood flow to reproductive organs. I wonder if that's like
cool. Nothing I'd straightforward thought about. I've just considered the bigger picture.
Yeah, it would happen secondarily, but it would still help.
Cool, absolutely.
Right?
Yeah. Decreasing stress and anxiety around that and things like that. So then with that, I can help people lose weight because being overweight or being obese is a chronic condition in itself. So that's part of it, because then more than likely you're carrying other things. So type 2 diabetes and type 1 diabetes. I have a client with type 1 diabetes and we're using exercise to help her manage that. Yeah. Same with type 2. Lots and lots of different things. Pretty much anything you can think of. Postpartum, prepartum, so being pregnant, post being pregnant. Mm-hmm. That's where an exercise physiologist can help as well. Yeah. Anything exercise related.
That's so cool.
I know.
I want to do the degree as well.
It was very good. Even things not typically exercise related. Anything health related. Yeah. Exercise has more than likely been proven to help.
Do you have like a story of a favourite client and outcome that you've had? Like came in with a goal and then achieved their goal through exercise?
So I had a younger mum who had a 2-year-old non-verbal autistic daughter. Yeah. Or daughter with autism. And she had been suffering with back pain for a long, long time. And so she responded really, really well to me explaining pain and to us changing some lifestyle behaviours. So she really liked to run, but she hadn't really been running. Someone had told her not to stretch because she was hypermobile as well, so that she shouldn't be stretching, and she didn't really understand why she was feeling pain. So we were able to, actually we're going to have a guest on in a couple of weeks, maybe, I think a couple of episodes time. Yes. We're going to have someone on who's going to help us explain pain, which is going to be really cool, because that's pretty much what I did with this lady. So we looked at all the other factors addressing her life, the stress from looking after her daughter all the time. Her daughter would sleep in her bed and interrupt her sleep, so that affected what's going on. She didn't do a very good warm-up before her runs, so we changed that. She had some tolerance issues with hip flexors and glutes, so we got those a bit stronger. And so it was kind of like this multifactorial approach that she responded just so well to. We made a gym program, and so she did that consistently herself. I can't remember, 2 or 3 times a week. She did her runs like she was supposed to. She challenged her thoughts when they came up in everyday life, and it was not long, maybe 2 or 3 sessions a month apart, and she just felt so different. And not necessarily pain had completely gone, but because she understood why it was there when it was there, she knew how to respond to it.
The mentality is so important, and massive. That's what you're going to.
And by the time, because I ended up leaving that workplace, by the time we were leaving, she was like thinking of having a second kid and like ready to kind of take on the next challenges because she was able to better deal with her life. And
That's
that was just,
so cool.
it was just brilliant because she was just so receptive. And that was really, really fun.
And clients like that are just the best, aren't they, when they are ready to change and put in the effort, right? Because there's only so much we can do as practitioners, but when someone takes it, you know, by the horns and goes for it and they really reap the benefits, like that's the best thing ever.
I find the ones that have good emotional intelligence are good like that.
Yeah.
So she had a mental health support worker background, and then another older lady was a psychologist, osteoporosis and scoliosis, and she was just amazingly open to listening to me as a professional, and it was really refreshing. And so when I showed her the latest evidence for strength training for osteoporosis, blah blah blah, and she was like, yeah, cool. And then she gave it a go, and then she loved getting stronger, and she took to it really, really well as well. And we made some modifications, like the way she was washing her dishes. We got, I can't remember, it hurt her back or something, so we got her a step stool to stand on while she washed the dishes, and just things like that. Like we were able to work together to highlight what was happening in her life that could be changed. And then we did, and then it made so much difference. And like stroke rehab, I really enjoy because usually they don't exercise, so you can get like within 3 months massive changes because they're actually exercising. And you could go into like the neuroplasticity of the brain, and you can make clients relearn things, and it's just fantastic.
And we have talked about that a lot, like the brain connection with mental health and growing new neurons. What was that episode?
Because I was one of the early ones. I think number 2. Mental health.
My brain was like, this is so cool. But there's so much potential, isn't it? So much more than strength gains in muscles.
Absolutely.
Like,
and I think I enjoy that realm because it's directly related to the exercise you do. Things like weight loss have this diet as this massive component that if I see you once, twice a week, I'm not sure what I can put on you. But 2 sessions a week of resistance training for someone recovering from stroke is massive.
Because it's more A to B, isn't it? Like this will cause this.
Absolutely. And this is not the only factor, but a major factor in what's happening, you know. And then from that, you can increase their confidence and self-efficacy and their motivation. And then that has follow-through changes to moving more at home and eating better and whatever. But it's a little bit more direct what you're able to do. And like that's why musculoskeletal rehab, so like you rolled your ankle or whatever, that's why those are quite rewarding as well, because exactly what you're doing has an effect on what's happening. I find weight loss as a goal a bit overwhelming at the moment because I just don't.
Because there's so many factors. No, that's so
and
true.
I get a little bit, if I see you half an hour every week, what am I going to do for you? Like kind of mentality. So
it's always going to help. Like you've got to remind yourself that what you do is always going to make a difference. But when there's lots of factors, sometimes as a professional, it can be like, oh, like I'm trying so hard. Like I just want to help you. Like I want to fix you. And
that's a major
hard.
part of it that I've had to reel back is I'm not in charge. Like I'm not in control. And I can't fix everyone. And that's a massive thing to accept as a clinician, no matter what you're doing, is you have limited control over the situation. And as with my personality type, that is quite a challenge and something I've been actively working on for the last couple of years, because that's a massive component. Absolutely.
The 1 hour with us or you is like, you know, the smallest percentage of someone's day, isn't it?
And that's where the asking of questions comes massively, because I can give you an hour lecture on why you should exercise and its benefits it's going to have for you with your high blood pressure. But if you in your own words are able to tell me, I have a young granddaughter, or I have this new puppy, or I have this new job, and I'm not able to do those things appropriately, I can
find the motivation.
Fuel.
Yes.
Yeah, exactly.
Yeah.
And it's a bit more of an active process than you just sitting there passively and me telling you.
The why
X, Y,
is
Z.
so important, isn't it?
Absolutely.
Yeah.
And that's where the behaviour change component comes in, is you have to be really good at finding the why.
Yeah.
Because we want long-term change, right? If we're dealing with chronic conditions, even if we're not, just to be happy and healthy, we need long-term change. So who cares me screaming at you for 6 weeks to follow my program if you don't then do it for the years after?
Yes.
So we have to find that.
Yeah, I'm just thinking for general public, I know that, you work with chronic disease. That's kind of your specialty and interest. But I'm thinking, females around my age that want to, or they're currently in the gym and they're not getting the results that they want to, or they're experiencing reproductive concerns or really high stress. Is that something that you would say, come see me?
Absolutely.
Yeah.
Yes. So and that falls into general health and well-being. I'm absolutely able to help with. So so people usually call exercise physiologists glorified personal trainers.
And that's kind of where I was going with that question. Like, you're more.
Yeah.
You can do more.
I believe, and this is like a stereotypical, because we'll kind of go into that as well. I want to talk on physio and personal trainers as well. But if we just take what you could assume from the title, I have more knowledge on anatomy and exercise prescription and rehab principles than a personal trainer does.
Yeah.
So personal trainers, in theory, are supposed to only work with healthy populations. So you're supposed to not be injured, not have anything going on, to work with a personal trainer. That doesn't happen.
That does not happen.
Everyone has something.
Yeah.
And who doesn't have an achy back or an ankle they rolled 5 years ago or whatever. So it doesn't happen. But in theory, it would go personal trainer, healthy population, physiotherapy for acute conditions, exercise physiology for chronic management.
And that makes a lot of sense.
Yes, but physios can be really good at that long-term management as well. Physios can have really good exercise prescription base. It's just not necessarily taught in the base degree. So if we take someone fresh out who hasn't done any extra reading or looked into and had no prior experience in anything, just based on what you learn in the course, that's how it would be.
Yeah.
If that makes sense.
Yeah. And it's kind of like every profession, isn't it? Like, you can get really good ones of anything if they put in the time and effort into research and learning. But if you want to make sure this person knows, exercise physiologist, because they've done it.
Yes. But like, even then you can get terrible exercise
Yeah,
physiologists.
you
Or you can get exercise physiologists who worked with ECG for 5 years and haven't done exercise prescription since they graduated. So like,
get to know your professional, in other words.
Yeah.
Find out if they can offer you what you want.
Yes, fine. Yeah, make sure they have the experience in what you want them to have experience in. Absolutely. Because same with physio. Some of the physiotherapists have just a brilliant concept of strength and conditioning and how to utilize it. And you have sports physios who work with the elite sporting teams, and they're just fantastic at managing, well, athletes.
Yeah.
But then just people in general. But at the base of it, exercise prescription would be best done by an exercise physiologist. Yeah. Again, very broadly.
Back it up. Be confident.
Yeah. Well, I don't, because I know physios who are really, we just had one on.
That's very true, didn't we?
Who's really good at that type of stuff as well.
I've worked with some great physios as well, actually.
Yeah.
And you just know that they're good. Like, it's so weird. You just sense it. You're like, oh, you know what you're talking about.
Really what the take-home message there is exercise is a leading, scientifically backed method of treating injury, for one, and chronic disease. So if you have one of those and exercise hasn't been considered as a primary part of your rehab goal, then maybe whoever that clinician is, maybe that clinician isn't the person for you. So that's so physio, ex-phys, whatever. If you're not addressing it with some element of exercise, then you could be doing better, in my opinion. Yeah.
And where can the people of Perth see you, Shelby?
So that kind of leads me on to, I wanted to touch on our governing body as well. Because I know we did for nutritionists. Yeah. So there's a bachelor degree you can do to become an exercise scientist. And that's kind of like a university qualified personal trainer. in that they are supposed to only work with healthy populations as well.
Okay.
And then I did a year of postgraduate. I did a graduate diploma to become an exercise physiologist. You can also do a 4-year undergrad to become an exercise physiologist. You can also do an extra master's program to become an exercise physiologist. But we are accredited under Exercise and Sports Science Australia, so ESSA, and they have a directory on their website where you can find
Okay, cool.
exercise scientists, exercise physiologists. Then they have a little bit more as far as like sports and coaches and things like that as well, because they cover that. So you could search me under there and find where I work. Or I work at Willpower Health and Fitness in Malaga in Perth, Western Australia. And so we are a fitness gym as well. And then I do rehab within that environment as well, and teach Pilates and exercise classes and all that kind of stuff.
Highly recommend. I go there myself.
It's a small gym, but it's an effective gym.
Yeah.
I think there's not a whole bunch of bells and whistles, but it's good. What we have is good.
Oh, I think it's great.
Good.
There's heaps of resources.
I think it's a brilliant gym.
Yeah.
But if you walked into like a bigger commercial gym,
I see.
we wouldn't look as kitted out as they do.
Yes.
Because you have to know what we are a personal training, like we are a supervised training based facility. So that means someone more knowledgeable can help you utilize what we have.
Yes.
Whereas having 20 machines for all these different body types in a massive gym is easier for someone just going in by themselves, because you can just jump on a machine. So yeah.
Awesome.
I know.
Any other notes?
Not really. As far as our like accreditation, I have to stay up to date with CPR. I have to prove that I'm practicing. I have to continually develop my skills. So every year I have like 20 points that I have to accrue that show I have done research.
Kept up to date.
Yep. So we're expected to stay up to date with current research. Absolutely. Then we're kind of somewhere in the middle between a physio and a personal trainer. They're the two I most likely get
compared to. Yeah.
And so on that, physiotherapy does manual therapy. So they'll give you dry needling and massage and bits and bobs, where I don't ever like touch my clients like that. I have no manual therapy skills. I like know how to tape things up, but it's not a primary like
a skill
role. Yes, that's just something I've done extra study into, or because I started in physio, I learned it in my 2 years of physio degree.
Yeah.
Actually on that before, we can work with, so your private health insurance can cover exercise physiology. Medicare will cover some exercise physiology sessions. So just like you can get your sessions with a dietitian or physio, you can get sessions with an exercise physiologist. You can come see us just privately, so you can pay to see us.
Yes.
And I wanted to mention that too.
Yeah, because that's important, because sometimes cost can be a barrier, can't it?
Absolutely. So that's something that's only happened in the last couple of years, our recognition with private health insurance companies, and we're still becoming more recognised. Like physio will still get more money than exercise physiology. Yeah. And exercise physiology for, I think, most places is still considered an extra that you have to make sure you have. Whereas physio is a bit more like dental or whatever, where it's just on there.
Yes.
So ESSA is working on making that bigger.
Awesome.
And you can see it on some websites now, like Diabetes Australia and Cancer Foundation and stuff will actually refer you to an exercise physiologist now instead of a physio, which I think is a really very cool move. Yeah, I think it helps distinguish
your roles.
Yeah. So that's been really cool recently as well.
Yeah. That's amazing.
Yeah. But we are here. We are effective in what we do.
Yeah, we are here. I was like, where are you going with this? But I do.
Physiologists exist.
You are underappreciated, that's for sure. Or just not well known.
Yes. Yeah. So recently in the last couple of years, a whole bunch of universities have now included an exercise physiology degree, whereas it was only offered at like 2 or 3 places when I was there. Now it's like nearly every uni will have an exercise physiology degree, so that means more of them will be graduating, which means will be more around, which is really fun. Yeah, so it's cool
I
too.
think every gym should have one.
I think so too.
Yeah,
I think even so, where I am, I'm happy to give advice to personal trainers on certain conditions, because technically a personal trainer, if your knee is hurting, technically they should avoid your knee, right? Like they shouldn't try. Yeah. Which isn't really what happens. No. And it's not an effective situation. So if a PT can come up to me and be like, this is what my client's experiencing, and I can say, have you tried this, and at least give them options to work with that and get that stronger, then I'm happy with that as well.
Yeah. Yeah, and that's really cool.
And PTs can do a whole bunch of extra training. Like my boss has been, I don't know, like 10 years or something, and he knows lots about like musculoskeletal rehab. Like if you get a calf tear or roll your ankle or have a sore shoulder, from what I've seen, he's, fairly clued in as to what that means. Yeah. And you can get PTs who are really, really good rehab. They just don't necessarily have the qualification, like name for it, if that makes sense. So I'm not out ruling anyone, It
is a hard topic to talk about because there's fact, but then there's always a grey area where people go away from the typical cookie cutter outline of a qualification, which is and because I've already looked so much into mental health and counselling and things like that, like past my actual degree. So you do all this extra training and that can come by paying for it, or that can come just by reading, or that can come by experience. So there are lots of different ways you can get that. Anyway, but yes, I don't want to step on any toes. No. And people find the people that are meant for them. I think you attract what you give out, and that's what I'm finding too. People realise what your passions are and what you can help them with, and they get attracted to you.
Absolutely. That will come across in how you speak to people. Absolutely. And that's, one of the biggest things as well. Whoever you're working with, you should agree with their treatment plan, and they should have taken into account you and your individual situation in the treatment plan as well.
It's massive. Massive, massive, massive. Yeah.
Cool.
Thanks, Shelby.
No worries. Thanks for listening.
That was interesting.
Good. I hope so.
Let's all appreciate exercise physiologists a little bit more.
Please.
Let's have a look for them.
Come see me.
Yeah, and just, as you said, takeaway is that if you suffer with chronic health conditions or injuries, exercise is going to help you. It will not harm you. Yeah. Shelby's just nodding her head with her eyes closed.
Need to, you still hear silly stories from GPs or specialists or whatever, just not recommending exercise. And you're like, where are you? Have you looked at the research? Anyway, thanks for listening.
Thanks, guys.
Extra content at turnsounds.com. Plug in. You can help support us on the podcast, or moveyourmind.podcast if you want to check out our Instagram. And Abby Renee _nutrition is Abby's Instagram account.
Yes.
If you didn't check out our What is a Clinical Nutritionist episode, definitely check that out, because you get information on how to see Abby as a nutritionist as well.
Yes.
I'll see you next time.